You're listening to Where Before Meets After.
I have a butt question. Are there patients now who've lost a ton of weight who maybe previously would have never considered having an aesthetic procedure to reshape their butt, who are now in that market? Is it a completely different person than the butt patient of the previous decade, maybe?
I think it is a different patient because the tissues are often very compromised, very damaged. A lot of them who are coming in for surgery are having surgery because they've lost so much fat that they now have all this extra skin. And some of them don't even have enough to harvest to make that adequate butt. And the scaffold, the infrastructure to the butt is just not there. It's not what it is in the other patients. So you're not going to get the same results.
I would add on to that. I'd say in general, when we're talking about body contouring, rebalancing the body, right? We have one of two problems. We either have too much fat or we have too little fat. And it is interesting, right, to see that shift with the GLP-1s that we're more and more coming into the issues of now we have too little fat, right? We're needing to add fat back. We're needing to give volume back to help balance that body more towards that ideal shape that we're going for. And that's a huge change from 4 years ago, right? 4 years ago, it was, we need to take away as much fat as we can to then almost like taking a stone. How do we carve that stone into a final statue? And now it's very different. Now it's like more to Dr. Epstein's point, a rehabilitation, reconstruction. We've got the finished statue. It's just parts of the stone have cracked off. We've got to figure, how do we add it back on?
So there are people who have just enough fat, but they're not coming to see you because they don't need to have more or less fat.
And that's a good point, right? Now you can have just the right amount of fat, but like, what if it's not in the right spots? I think one of the best examples, even in this GLP-1 era, is bra rolls, right? I think like bra and back rolls have become a much bigger issue for people because you can cut your weight down to almost anything. And you're still, if you had a back and bra roll there, it's very hard for it to go away with diet, exercise, and loss. So
why is that?
Because the skin is bound to certain fixed points like the ribs. That's what creates the roll. The fat expands the skin between two fixed points horizontally, and that expands a roll. And then now that the skin has been deflated, it's just like a sagging breast after pregnancy. It doesn't have the recoil. So now you have all this extra skin, and lipo isn't going to help. And if the extra skin is beyond the point of radiofrequency skin tightening, then you're faced with doing a back lift.
do you do many back lifts?
I wouldn't say many, but I do them. And when I do them, the patients are very, very happy. But it takes a lot to push me to do one because it's a big operation and it's a big scar, albeit you can hide it with a bra. It's usually massive weight loss patients where they don't care about scar. They're just more interested in the contour.
The other thing I'd like to jump back on that and just say, in those people that we're talking about sort of just enough fat, whether or not diet and exercise, whether or not that's just how they were born, or whether or not they're post GLP-1, right? I think in GLP-1, for anybody listening, semaglutide, tirzepatide. Although I feel like now you can just say GLP-1 and anybody that's listening probably knows, right? It's like, so.
Yes. Thank you to the pharma companies for forcing us to call it by the category name.
Right.
Yeah.
The bra roll, you'll always have a little bit of posterior flank fat, no matter what you try to get rid of it. So we can just take those areas and balance that down to whether that be the hips, the hip dips, maybe it's a little bit of upper buttock volume that got lost. And those subtle changes, I think, just really restructure somebody. We're not trying to do what we were doing 5 years ago, where it was just such the bigger, the better. You know, I mean, the curvier, it's just how do we balance you back into a more naturally aesthetically appealing.
Yeah, you can talk in generic sense about all the different options we have, but it really comes down to when you see that individual patient, ask them what it is that they want, assess their tissues, look at the quality, how much extra skin, how much fat do they have, what are the options? And there's oftentimes more than one thing that you can do. You present the options to the patient and let the patient decide based on what you tell them what is best for that patient.
Close out the fat thing. I have one last question there.
Oh, I got something for you on fat too.
Throughout your body, the fat is not the same everywhere. Like, is it accurate that you could take fat from one part of your body and you probably shouldn't put it in the face because it's not the right kind of fat? Or
well, with the face, the fat in the face is of different size, call it different parcels. And as you go more superficial, the parcels get smaller and smaller. So when you're harvesting fat for facial fat grafting, you can take it from the abdomen or the inner thigh or the flank, And then you can put it into a device called a lipocube or an equivalent device that cuts it into different sizes. So when you harvest the fat, it'll come out as what we call millifat. The particle size is one size. Then you can cut it into microfat, and then you can even make nanofat. So in the face, for structural things, you can put in the millifat, and then as you get a little more superficial, put in some microfat. And then the nanofat actually has regenerative capabilities. So you can inject it right into the dermis and reverse the aging on the skin.
Mark stole my thunder there because that was my.
Oh, I'm so sorry, Matt.
That was when we talked about new things with fat, and we went to the synthetic fat. And that's what I said. There's actually some cool things going on with fat itself. Nanofat is obviously one of it. And that was my first branch there. And then the second thing I think is cool, again, coming out of South America, is they're taking, now when they do like their tummy tucks, et cetera, they'll actually take some of that fat from the lipo. And as they're doing the tummy tuck, they will repair the tummy muscles to bring them back together. But they'll actually inject a little bit of fat under direct visualization into the actual tummy muscle, the rectus muscles themselves. Not to create a big steroided, like huge bulky muscle, but just to give it a little bit more bulk. And it's really cool actually to see how that plays out post-operatively, because now when we're sculpting, trying to form 3 dimensions, we actually have a back base of muscle that gives a little bit more push and we're getting a little bit more shape. So I think that's a really cool thing that's honestly going on with fat in another application of fat that we're using.
What's driving all this development in the fat category?
It's really interesting to go back to it because for the longest time, fat was just kind of not paid attention to it. We looked at more as a problem.
Discarded.
It was medical waste.
Yeah. And in plastic surgery, we had the idea we couldn't even use it. Its blood supply is too delicate. You can't transplant it. You can't do anything with it. And then probably early 2000s, wouldn't you say, is when the idea of like stem cells and I'm blanking on the very famous man's name.
Michael Longacre.
And then who the guy was injecting the fat in the people's hands in Sidney Coleman, right?
Yes,
Coleman.
Yeah, Coleman. I mean, these people, again, just pioneers willing to try some things.
Who looked at the fat and said, "Why are we throwing this away?"
Yeah, right. Hey, who heard a complaint from his patients that they were loving his plastic surgery he was doing. They hated when people were taking photos of their rings because it gave away their age because of how aged their hands look. And he thought, well, couldn't I take some of this fat and start to spin it down and give that back? And would that make the hand look better? I mean, it's just crazy.
Yeah, it's when you get away from the paradigm of just remove. And as Matt said, it's body balancing. It's filling in the peaks and the valleys and creating the contour that you want. You have to have something to do volumization.
All right, give me your Instagram, your website, and where to find you.
EpsteinPlasticSurgery.com. And our Instagram is dr.mark, M-A-R-K, Epstein. You can find me on Long Island in Hauppauge. It's in Suffolk County.
And I am a SoCal plastic surgeon, Matt Nykiel, in Newport Beach.
Thanks for listening. I'm your host, Eva Shea. Follow the show and submit questions for our experts at wherebeforemeetsafter.com. Where Before Meets After is a production of The Axis.